Hello, my name is Adeline Roseby, and today for the article to be looked at, the topic was music therapy for depression. So, the cognitive principle that we looked at was depression and how music therapy can assist in helping depression as well as depressive symptoms. How this article wanted to explore the concept was by reviewing 5 separate studies that have already been researched, and then what was reviewed was the effectiveness of music therapy on depression, looking at how it has an effect on depression and whether or not there was a positive or negative significant effect on depression. So, what the study was about, the study had many different objectives. One of them was to look at what are the effective treatments of depression and whether or not music therapy fit into that model, with its primary goals and objective was to see if music therapy would decrease depressive disorder symptoms overall. Clinically defined music therapy and what are examples of techniques used, as well as context as to where it can be most beneficial, especially with geographical context, and what are the requirements of who can actually administer it. The main objectives were to A, clinically define music therapy and depression, B, finding an appropriate amount of credible research with support of a small randomized control of music therapy and the waiting list control of adults with depressive disorders, and if there is a positive correlation, and C, to identify what measures need to be done if the evidence reviewed it was not adequate. So what exactly is music therapy? Music therapy was defined as an interpersonal process in which the therapist uses music and all of its facets to help patients to improve, restore, or maintain their mental health. Music therapy techniques are more versatile than other therapeutic approaches as it can be more active or receptive. Music can be used in many different ways, whether it is self-composed, being the more active and engaging approach, or the client can use a more receptive approach where the client or the psychologist can choose the music that would be needed. What was also looked at were more specialized areas of music therapy as well. Other forms of music therapy that were looked at would include neurological music therapy, which uses music for cognitive, sensory, and motor dysfunction with neurological rehabilitation techniques. This was briefly looked at and described as it would typically be delivered over a wide range of time periods where it could be anywhere between a few weeks or several months to years. So why was the research important? The article is important as it was a critical review in reviewing what limited research at the time there was in music therapy and what the potential effectiveness could have been. The article could also have had beneficial factors for those who are looking to further their own understanding on either a more basic or complex level of what music therapy is and what the effectiveness on mental illness, that being depressive disorders here, could potentially be. By reviewing 5 other articles, it essentially takes the quote-unquote work out by finding the clinical definition of what music therapy is, as well as depressive disorders, determining whether it's effective or not, and reviewing criticisms and highlighting what further research would need to be done. So what exactly did the researchers do? As there were 2 authors, both of them individually reviewed 5 different full-text articles. For the studies to be considered, they had to meet the selected criteria, that being all randomized controlled clinical trials that were published in any country that were eligible to be considered. For the actual intervention for music therapy to be considered, it would have to be administered by a trained professional, with that being by U.S. standards of graduate bachelor's or master's level. It would need to also be carried out through sessions that followed a structured therapeutic framework. The main therapeutic change has to be described, that being the music, and then the relationship between the music and therapy results, and the interactions as well as benefits of the session would also have to be mentioned as well. By measuring the decrease of depressive disorders, it used the Beck Depression Inventory Geriatric Depression Scale, and Hamilton Rating for Depression. So what were the findings? After reviewing the selected studies, all besides one specifically did screen for depressive disorder symptoms. What was also found was a active approach was reviewed that had a positive effect for the relationship between music therapy and lowering depressive symptoms. The two methods looked at were music therapy delivered by a therapist, and then there were techniques that were taught by the therapist. The primary outcome was to see if the self-rated scales showed a decrease of depressive disorders, and in all scales, lower scores were shown that indicated lower levels of depression. For implications and criticisms in no particular order, it was found that it focused more on participants that were of adolescents or older adults. It was also found to be more useful when applied by a shorter term rather than a longer term, such as it can be comparable to cognitive behavioral therapy homework. Sources that were used were found to be credible. However, interpretations of some data would need to be just have a bit of caution when interpreting that once again. And as usual, there was obviously more research that needed to be done, as it was a very lightly looked at topic when looking at this specific therapy approach and the mental illness looked at as well. Thank you so much for listening.